Okay. Awesome. So I'm just going to have you introduce yourself, like what sport you played, like when you went to Stanford, and sort of your physician path, and like where you are right now, and like what you're practicing now.
Okay. All right. So I'm Stacie Solt. I was a 4-year Stanford rowing participant, Stanford rower on the crew team, women's crew team. And I was actually a walk-on onto that team and just made it work for 4 years and absolutely loved it. I was part of the team from 1999 to 2003. So the Stanford rowing was definitely on the rise in terms of its strength and ranking and just success. I ended up rowing with several other Olympians, which was really exciting. And I actually stayed an extra year, even though I had graduated, but I was staying in the area to work before applying to med school, and I coached the novice team. So I stayed quite involved with the Stanford rowing team for all 5 years, and I still keep in touch with teammates and my former coach and such. But I knew I was going to take a full year off after graduating from Stanford, just because the application process was so intense, and trying to be a student and a student athlete, and rowing is a 2-season sport. We have fall competition and spring competition, so I wasn't organized or had the energy or capacity to do it. So I knew I was going to take a year off. And then when I graduated, I decided to just literally take a full year off and really think about what I wanted to do, and be sure that this was the path that I was embarking on was in the best choice. So I didn't start applying until a full year later, after graduation. So I started the application process, I guess, in 2004, and then entered medical school in 2005. And in that time, those 2 years, I worked for a year coaching rowing, but then also I did behavioral therapy with autistic children in the Bay Area. So I stayed in this area. And then the second year, I actually went back to my high school in San Francisco, and I worked, it's a private Catholic high school, and I worked in the admissions department. And so it was funny, I was helping to accept the class of 2009 for high school while I was applying for the class of 2009 for medical school. And I coached freshman basketball there. So coaching and sports and athletics has always been a huge part of my life. And I think it's really served me very well in going into medicine, especially emergency medicine, where I'm at right now. I do emergency medicine and addiction medicine. And after medical school at UCSF in San Francisco, I actually went back to Stanford for residency. And now I'm in practice in the Bay Area in San Mateo County, doing mostly emergency medicine, but there's a lot of overlap with addiction medicine in terms of how I spend my time.
So what high school did you go to?
I went to Sacred Heart Cathedral Prep.
Holy cow. I went to Notre Dame, San Jose.
Oh, yeah. That's awesome. Yeah. Oh, that's so great. Yeah. No, yeah, I know Notre Dame Belmont is very close to where I work now, but I know all the Catholic schools, and especially competing in different sports. Yeah, Notre Dame San Jose had some strong athletics programs, and then watching the boys, Bellarmine, and then Midi was like our big rival. Actually, Carrie Walsh overlapped. Well, she barely overlapped with
enough.
It was close enough, yeah. So Midi was our rival, and especially basketball and volleyball as well.
Yeah, and what did you major in?
I majored in human biology. Okay. So it's actually a really with a focus actually in adolescent development. It's a funny story, and looking over your question, sort of what brought me to that path. I knew I wanted to go to Stanford from the age of 8. I visited campus and I just sort of declared, like, this is where I'm going to go. And any excuse to be down here was huge, especially growing up in San Francisco. So it was basically full speed ahead in going to Stanford, and I did early admission and got in. And so but before I even started my second semester of senior year, I knew where I was going, and it was huge. It was huge. But when I was kind of being sure that this is what I wanted, my junior year of high school, there was a girl that went to my high school that was 3 years older than me. So she was a senior when I was a freshman, and she went to Stanford. And I absolutely admired her. Great personality. She played basketball. She just was very well-rounded, student body president, very easy to talk to, spent a lot of time talking to me, this freshman, and she knew I wanted to go to Stanford. So when I was a junior and she was a sophomore at Stanford, I was able to stay in the dorm with her overnight and sit in on some of her classes. And I remember going to the Hum Bio core curriculum class and sitting in on that, like side A and side B. So I don't know if they still do that, but I just remember sitting in this room for hours and just thinking it was the coolest thing ever, because it was integrating so many of my various interests. And so I always had this, and I knew it was the biggest major at that time, and I always had this idea of Hum Bio in my mind. And my friend Lisa, who was like sort of my mentor, by the time I did get to Stanford, she was a senior again now in college, and she had done the Hum Bio track and was graduating and was applying to med school. So I kind of was like, well, I liked that class a couple of years ago, and it seems like all these people that are going into Hum Bio must not be wrong if it's such a big major. So I was like, oh, I'll try it out. At least I'll take the core curriculum. And it was great. I did well. I enjoyed it. So I was like, okay, my mentor, Lisa, strikes again. All right, now she's going on to med school. Maybe I should consider that. So, I mean, I thought it through myself, but it was nice to have sort of a path that I was following with someone that I really, really looked up to. And what was very cool was when I was in med school at UCSF, she didn't go there for med school. She went to UC Davis, but she did her residency at UCSF in pediatrics. And so I worked with her again as a med student. She was a resident. So our lives have overlapped so many times, and I really give her a lot of credit for kind of paving the way and sort of showing me the path that I thought would be a great fit for me. So yeah, so it was, and I kind of was open for anything else, but it seemed like a good fit.
That is such a phenomenal story. Wow.
Yeah. So.
Wow. That is so different than my experience. That's fascinating. Yeah, that's so cool that you knew so early on, and that you had that experience of being in a Hum Bio class and really latching on to it.
Yeah, absolutely. I just felt at home. It made me so excited. It was early in my junior year, and it made me so excited. Like, I need to get to college. I need to get to college. I need to get to Stanford. Just because I just found that energy and the excitement so enjoyable. It was exactly what I was looking for. And I got to stay in the dorm. And sort of a total side note, one of my friend Lisa's dorm mates was there, and she had a first date that night with this guy, and he came over. It was 553 Mayfield was where they were staying. I think it may be renamed. And he came over that night after the date, and they stayed up all night talking. They are now married with multiple children there now, but like, I mean, this was a while ago, but I was like there at the moment that like the sparks flew. And so I always was like, I'm going to meet my future love at Stanford. Like, I got all romanticized because, you know, I don't know. It was really funny. That didn't happen, but I did go into Hum Bio and medicine.
Oh my gosh.
Yeah, it was a very impressionable, like,
Wow.
visit with my friend Lisa. Just 2 days there, 2 days of classes and one overnight in the dorm. And I was even more set on what path I wanted to go on.
Wow. You never know what experience is going to absolutely completely change your life.
Exactly.
Wow. So talk to me a little bit more about like what you did to prepare for med school. Like, were you in any research labs? Like, did you do shadowing? What did that look like for you and your rowing schedule?
Yeah. So I was lucky in that I think they still have it. The SCOPE program was just.
Oh, you were in SCOPE?
I still have the scrubs. They're the first scrubs I ever got. And so it was the first year of the SCOPE program. So I kind of was part of that as it launched. And, I don't know where it's at now, but like it was at Santa Clara Valley Medical Center emergency department, and we did shadowing. So I was in the emergency department, And I did like day shifts, swing shifts. I was always partnered up with a physician there. And so I learned a lot about hands-on medicine because I mean, my experience in the hospital, I'd either been in as a patient or a patient family, you know, a family member or something, and never as a provider. So in an emergency department, I'm sure those early experiences kind of shaped me into going into emergency medicine myself because I thought they were incredibly valuable. I got to see a lot. Santa Clara Valley Medical Center is a trauma center. So we saw everything from like heart attacks and strokes and, you know, broken bones to like gunshot wounds and stab wounds. And I was able to like, I mean, I couldn't lay hands on anything, but I was able to be in the room at all times for every encounter. So I saw a lot and just got familiar with the language of medicine. So I enjoyed that quite a bit. And then I did spend one summer doing research at UCSF in the family medicine department. I never did like bench research. I never did any of the.
What does bench research mean?
Oh, like bench research, like pipettes and.
Oh, like a wet lab.
Like a lab. Like I never worked in a lab. It was always clinical research. I know some people do more work with cells and I don't know, stuff that I was just like I couldn't wasn't interested in or just wasn't as interested in. So I did clinical research on domestic violence amongst Latino women in San Francisco. So it was very focused and it actually meant a lot because I was from San Francisco. So I got to work with a physician who I knew sort of was a friend of a friend. And I also was working with a population that I cared a lot about because this is like my hometown. This is like where I grew up. And then my senior year of Stanford, my like longitudinal project was doing research at Stanford psychiatry department in OCD amongst children, pediatric obsessive compulsive disorder, which kind of led me into working with autistic kids. When I graduated, there was a significant overlap in a lot of the knowledge and the skills based. So it was mostly clinical work. I didn't do much in terms of kind of the basic sciences and any of that kind of research. But a lot of it, I think, was just clinical exposure, just spending as much time in the hospital as possible and being familiar with the language.
And with those,
and I might have become, we have scribes now. I don't know if you know what scribes are, but they follow physicians or other providers around and they basically like take our notes for us. So it makes the documentation side of things much easier. And so they're much like I was in the SCOPE program in terms of shadowing, but they're actually serving a purpose and earning a little bit of an income, but they're writing down all the information that they get. And so I find that the scribes that I've worked with who have gone on to PA, physician assistant school or med school, or even we had podiatry school and nurse practitioner and stuff, have done very well because just like learning a foreign language, they're learning the language of medicine. So I would have totally done that had that opportunity been there when I was at pre-med school.
And with those research things that you spoke on, how did you find those opportunities? Like, where did you just stumble upon them? Or was it like a professor that you had? How did you get in contact with those people?
So I know that they had done a little bit of marketing in terms of the SCOPE program. They had spoken with a lot of the HumBio students. So I think that's how I heard about it, or sort of word of mouth. They were, they wanted to get it kind of off the ground. But in terms of their research, the Stanford research was just through the Stanford connections and professors and my advisor in HumBio. And then the UCSF researcher was through networking. I knew somebody that worked in the family medicine department and I had her reach out to some of the physicians that she worked with to see if they had any summer projects.
Gotcha.
Yeah.
And then I guess, sort of now going into like you being a physician now,
Mhm.
what made you choose emergency medicine? Especially since, after hearing you talk, it seems like a lot of stuff would have maybe gone towards psychiatry.
Yeah.
So
Or
why?
pediatrics
Yeah,
even. Yeah.
yeah, exactly.
Yeah. So I'm sure that there were some formative moments during the scope program in finding just the excitement and the variety that you see in the emergency department. I kind of liked being sort of the jack of all trades because you get to see a little bit of everything. And there's an excitement. I mean, I'm a bit of a adrenaline junkie, and emergency medicine physicians are known as pretty adventurous in a lot of ways. I mean, we keep crazy schedules and tend to be a very tight-knit group. But one of the things that I really enjoyed is that you're never alone in the emergency department. And I actually wrote my personal statement for residency about being a rower and comparing being in the boat with the coxswain and the sort of going down the course with like running a code or a trauma, and somebody at the head of the bed running the code as like the coxswain, and each person on each side of the bed, just like each side of the boat doing their role and stuff. So I think the teamwork dynamic and the feel I got when I worked in the emergency department in med school just brought up a lot of similar dynamics to when I was in the boat with the crew team. So I'm sure that served me well, because you always have people to like bounce ideas off. There is that energy, that excitement. You really, I mean, I just work well as a as a team member. So I'm sure that had a huge thing. And some of it was a little bit of indecisiveness because I didn't want to pick a particular specialty that I would only do that. Like I like the idea of knowing a lot about different subjects in medicine and keeping that all active. And also I'm a very social person and like networking and talking to people, and you certainly do a lot of talking to people, not just various patients, but also different providers. We call consultants all the time if it's something that is above our skill set. And I feel like I build rapport pretty quickly with people. And I think although having an interest and a background semi in psychiatry actually serves me well, because you have to go in and meet people at some of their worst moments of their lives and build trust and build rapport for them to communicate with you and communicate with families if it's a real severe situation, like an end of life thing or making decisions on behalf of their family member, and have them trust you. So I think the psychiatry aspect served me well. And then I ended up doing a subspecialty or a fellowship through the psychiatry department after med school in addiction medicine. And so that also serves me very well in the emergency department. We see a lot of patients with addiction issues. So there's a lot of overlap, and I almost went into pediatrics. Actually, my original plan was to do pediatric emergency medicine, and I still do a lot of pediatric emergency medicine because our emergency department sees all ages. And I actually think that that's probably better because I see a good variety, not just kids, but I do love seeing kids.
Yeah. So what is like the thing that is most difficult for you with being a physician in general, or specifically in the emergency medicine department, which I can imagine is quite intense.
Especially these days, yeah. So there's a lot that I felt like I was prepared for in med school and even pre-med track in terms of the science and the academics and understanding the physiology and anatomy and stuff. But there's so much more to medicine and the way medicine is practiced in the US in terms of the business aspects of it, the financial implications, some of the ethical and social implications and access to healthcare and things. I mean, once you work for a hospital and you're sort of out of the academic system of like residency, you start having to see kind of the bottom line in terms of the finances, and there's a lot of pressure, especially I work at a county hospital, to save costs, and it's always a balance of like helping, making sure we're doing the best for the patients, but also making sure it's sustainable. So there was a lot more of the business model that I wasn't privy to. And then the other thing is just the sheer amount of documentation and sort of legal, documentation that you have to do. Thankfully, California is not in, doesn't have such crazy malpractice, insurance and also claims. But a lot of people around the country that I've spoken with, especially in certain areas, you're always at risk of being sued if you make like a mistake. And we're human, and usually the mistakes are pretty small, but obviously life and death or life and limb, you have huge consequences. And so some of the stuff we do is, we say it's CYA, or cover your ass. Like, you do stuff that you probably don't think is necessary. And I feel like it's actually really wasteful, kind of going back to my original comment. But you don't want to take the risk of being sued. So there's so many other levels. I feel like the most difficult part is not the medicine, but it's like making sure that it's financially feasible and people like have the insurance to be able to follow up when we need to, and be able to document and not get in trouble, not put yourself at risk. And all you want to do is like practice medicine, see patients, like diagnose an appendectomy, like deliver a baby, whatever. And there's a lot of other administrative distractions, I guess, and requirements. And then the other thing in emergency medicine, especially, is unfortunately the burnout rate for emergency medicine is very high because our shifts are constantly switching. So I'll do like a morning shift and then a swing shift and then an overnight shift, and then you're back to the beginning. And some places are better about having kind of a little bit more of a regimented schedule, but my current schedule is kind of all over the place. So it's hard to recover after an overnight shift and then a few days later be up in the morning and working like a regular shift. So there's nothing consistent. You miss holidays and weekends and stuff because you just don't have a normal 9-to-5 job. So sometimes it's hard to connect with people because like I'm off on a random Wednesday and I can meet up. But I mean, these days it's a little bit easier with people working from home, but a lot of times it's like, well, I'm not free Friday or Saturday or Sunday or any evening, but in the middle of a day on a Tuesday, I could meet up, and that's not always feasible with the rest of society. And then in my addiction medicine, it's just a very challenging population to work with. There's a lot of suffering. There's a lot of relapse, which is part of the disease. And it's just a lot of people seeing them with such potential and such success, and then a relapse, like a substance, will set them back so far. And just sticking with that and being optimistic that things will get better. But I work with a very challenging patient population, and you don't get a lot of thank yous, and you don't have a lasting relationship with these patients because they're in and out. But I also know that I'm part of their most difficult day. There's a couple of nurses that made like a t-shirt that says like, we're the best part of your worst day. Because I mean, it is really true. You see people in just such crisis many times. But it's hard to like separate sometimes work from home life. And I think that balance is what keeps people in emergency medicine and in medicine in general, just because, I mean, the stakes are very high. It's not like a virus on a computer program. It's like a virus in a body that's like going to kill you, it's just different.
Huh. So then outside of medicine, either now or undergrad, like, is there anything else that you do to sort of keep yourself sane and like do things outside of medicine? Like, what are the things that you have been or do now that are outside of medicine?
Yeah, I try to not take work home as much as possible, but it's sometimes hard. As I've progressed in my career, I've gotten more and more administrative roles. So then it's nice because I can still contribute, but I don't have to financially and time-wise do as many shifts. I still do a lot. But the admin sort of forces me to work more at home, and it's almost easier to be either like I'm at the hospital and I'm working, or I'm out of the hospital and not working. And one of the nice things about emergency medicine is that we're not on call. Kind of the typical physician always has like a pager and they're on call. So if someone from the emergency department or the hospital needs them, you know, they may be at home, but you never know when you're going to get called in. Like emergency medicine, you're on, and you can also swap out shifts because you don't own particular patients. So I try to stay as active as possible, get out and about, exercise. I have a great group of people that I exercise with on a regular basis. I also love to travel, which has been driving me crazy lately, because the way I can do my shifts is I can put them all in a short succession and then have a string of days off. So I could make like every weekend, or I could like take stretches of 4 or 5 days off each month, a couple times a month, because of the amount of shifts I have control over. So I do love to travel, and I'm lucky in that, I mean, my entire upbringing, education, work environment has been here in the Bay Area. So I have friends that I meet up with that I've known since childhood, since Stanford, since med school, since residency. Either people that, I'm very close with my family. I have all my family lives in this area, so I see them quite a bit. So I think just having good social support is huge. Trying to pick up some sort of new hobby, but I haven't really, nothing's really stuck yet. But just trying to take my mind off of medicine, and also just taking the time to also process what's going on. I mean, it's good to like be at work and be at work and be at home, but I'd be foolish to not know that there's like overlap, even if I'm not fully conscious of it. So having some trusted people and ways to kind of decompress and get into, even though my schedule is not really of any routine, like trying to get into a routine of like, this is how I unwind after a shift. This is how I get mentally and physically ready to go to a shift, because they're exhausting. There's no lunch break. Like there's barely a bathroom break when it's busy. I mean, you're really just like go, 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 go. And that's why full time tends to be like less hours than say a typical like 9 to 5 job. Because when you're on, you're on.
Yeah. Wow. And like back to Ames, right? And like the role that you play as a mentor and someone who's been through all this before. What do you think like you bring to the table that you would like people to come and talk to you about? Like what do you enjoy speaking with future med students and physicians about? Because along with the spotlight, there's like a little week where people can sign up to meet with you, right? So what do you think that like people would want to talk to you about?
So that's really interesting that you mentioned that, because I was thinking about that when you sent the questions, and it's actually something that I haven't really talked about, but I think is really important, and I'm sort of at a spot where I can really feel like I have enough space to discuss it. So I mean, I'm sure just like you, just like any other Stanford student, especially student athlete, like you've been very successful. I mean, I decided at a young age that I wanted to go to Stanford, and that was like my whole focus. And I did well in school, and I did well, graduated top of the class in my high school. And then at Stanford, I found my major and did well. I mean, I wasn't like best of the best, but I did well, and I was successful, and it was great. And then I got into like my dream med school, and like everything's going well, and I did like well there. Again, I wasn't like at the bottom of the group or the top of the class, but I was thriving. And then I went to residency at Stanford, and I was so excited because this is like Stanford, and I like loved it, and I had such a good experience. But the Stanford of medicine and residency in general is very different than the Stanford of being an undergrad. And I think I had these sort of magical thoughts that it was going to be a same field, but I'm a different age, different responsibility, much different stress level. And I really struggled in residency, and a lot of people I know struggled, but I really struggled in residency to the point where I was falling behind on my co-residents, and I had a lot of shame and embarrassment, and I couldn't get back on track. And it seemed like I started questioning, like, is this the right specialty? Is this the right job? You know, like, should I even be a doctor? Am I capable of this? Like, this is so hard, and I'm just not, I've done well so much in my life, and I'm feeling like a failure. And I ended up going on probation, and the requirement for, and a lot of it was to get kind of like some extra resources and extra support in place. And the options after the 3 months of probation, which was the minimum, was to either stay on probation for another like 3-month increment, get off of probation and sort of be at the same level as my classmates, like where I was, or be terminated, like if it really wasn't going to work out. So that was definitely the most stressful period of my life, I think, because I hadn't like dealt with failure and setbacks to any big degree, especially in academics in my life, you know. And I think that the resiliency and the skill set that was needed to overcome that. And by the way, after 3 months, the best case scenario, I was off probation, everything was normal, I graduated, all was fine. I just needed some extra help. But kind of because I was like, I mean, I was in my early 30s when I went through this, and I felt like I had experienced failure for the first time, and I fell hard. And I know that Stanford students and student athletes in general, you have to hold yourself to a high standard to be that successful. I think it's impossible not to. But failure and setbacks, I kind of knew in the back of my mind was like, oh, you know, that's par for the course. But when you've been that successful, to have a setback, it really makes you rethink, like, not just your priorities, but what makes you you beyond the resume and beyond the accomplishments, and like, how do you overcome these challenges and reshape it rather than a failure as like an opportunity to grow. And I mean, this was years ago, and I'm only getting more comfortable recognizing like what it sort of the silver lining of what it brought about. So I guess the long answer to your question, I can't believe we've been on the phone so long, is that I think it's good to talk about when things don't go well, you know, and like, how do you kind of pick up your bootstraps and move on? And especially in athletics, I mean, there were a lot of lessons that I had learned about, you know, not winning a race, not making the boat or the seat that I wanted, and bouncing back from that. But I'd never had to like apply it to like academics, like the thing I was like really good at, you know. So I'd love to talk about people, I guess, people about not just applying like the skills in athletics and to going into medicine, and how I think that serves people very well, but also dealing with that sense of failure, and dealing with that sense of kind of reframing it as resilience. So that was a very long answer, but I wasn't going to talk about it, but I like suddenly decided today when I was thinking about your questions, like, yeah, I think that sometimes talking about when things don't go well is, and how you move on from that is sometimes the most beneficial thing, because I only heard about like things going well, I felt like, or I only wanted to hear that when I was going through the process, and not like the struggles that people had.
Yeah, thank you so much. That's I really appreciate you telling that story because you're so right. It's hard to talk about and it's hard to hear, but as we're going into a difficult field, we need to know to expect that, right?
Yeah.
Anyway, I know you have a meeting at 6 o'clock.
Yeah, it's not the most important thing, but if you, I knew this was going to take a while because I talk.
No, that's the very end.
Oh, okay.
Yeah. No, so
Okay.
thank you so much for doing this. I really appreciate it.
Yeah, absolutely. It was really nice to chat with you, and feel free to stay in touch if any other questions come up. And I'm excited to. I'm really excited to talk to anyone, especially Stanford students, especially Stanford student athletes, just because I get it, and especially Stanford student athletes going into medicine.
Yeah.
Great group, I think, is going to serve people well. And like I said, I really think that student athletes in general make great physicians and great teammates, and that's the biggest thing in my profession by far.
Yeah. So I will reach back out to you about when to schedule your little week to have like 4 people reach out. I think that's usually what we get. So yeah. Thank you. I really appreciate it. Thank you.
Yeah, no, this was fun. It's always nice to chat, and hopefully I didn't talk your ear off too much.
No, this was absolutely fantastic. Really
good.
I loved speaking with you. Thank you.
All right. Well, good luck with everything. Enjoy. All right. Bye.
Have a good week. Bye.